أهلا وعليكم السلام ورحمة الله وبركاته. تمشي على حمد.
Hello.
Hello.
الو السلام عليكم.
Alaikum salam. I want to make sure that you can hear me.
Hello, everyone. Welcome, everyone.
Hello.
So let's start. Who is ready for the discussion? Please take the lead.
Hello, Assalamu alaikum.
عليكم السلام ورحمة الله.
I'm supposed to have a presentation of the COVID updates, but do you wish for it to be at the beginning of the meeting or?
The presentation, or you have questions?
No, the presentation. The presentation.
Yeah, so let's start with that, the presentation, and then maybe if there are some discussion about the interviews, and then the last part will be about the projects, and if you have questions, what the next step and so forth. If that's clear for everyone, we can start with the presentation. If someone needs slide or to share the screen, let me know.
Okay, then if we are going to start with the presentation, I'm going to share my screen.
Okay, let's see. Anyone else is going to present as well with screen sharing, or do you know? All right, when you are ready, we can go ahead.
Okay. All right. So hi everybody again. And Happy New Year for everybody. Wishing you the best year. And I'm going to present facts and myths about the COVID vaccine. So everybody, I believe, is wondering about that, and whether you think about it, about yourself, or you heard it in the social media or from a friend. There is a lot of myths and facts about the COVID vaccine. Here I have some of them. First of all, why do we need to be vaccinated? So obviously the coronavirus cases worldwide have affected more than 80 million people. And and the deaths was over 1 million and almost 2 million deaths. The recovered was 59 million cases worldwide. So obviously it's a pandemic, and the need for the vaccine is essential. So people were wondering about how quickly the vaccine was becoming available to the market and how short the testing process was. Or maybe this is the political, how the political whole vaccine production effort has got because of the national election. And that's some of the concerns. So the fact here is the entire process went faster than usual for unexplainable reasons, but it still followed the usual steps for testing and review. The most important reasons for speed are the modern scientific tools, of course, which is faster than the old ones, and worldwide effort has come to reduce and remove any barriers and delays to the vaccine production process. So a large number of the ordinary people volunteered for the clinical trials of the vaccine, which meant to get the answer to key questions about safety and protection quickly. So part of the delay in studying a new vaccine is the time it takes to design a high quality and safe clinical trial. So for the COVID vaccine, the international organizations came together to agree on a study outline and goals. That's why we have seen the production of the vaccine have taken only months. So another big difference is that the governments agreed to pay companies to produce a large amount of their vaccines in advance. So even while the trials were in testing, how well the vaccine actually works in people. So the companies doesn't have to work about how they're gonna finance the whole process. Another myth is a lot of people thinking that the mRNA approach to the vaccine is new, and you might have some claims and worries about what might happen after it's injected into the body. So this includes that the genetic material in the vaccine will find its way into our DNA permanently. The fact is that the first two COVID-19 vaccines containing a specific kind of genetic material, and this is a messenger RNA, the messenger RNA in the vaccine does not need to go to our nucleus, of course, where the DNA is stored, in order to accomplish its mission of teaching the immune system how to recognize the coronavirus. So this is number one. The messenger RNA does not need to incorporate into our nucleus. Another reason is, in order to become part of your DNA, the messenger RNA would have to go through an extremely unlikely and hypothetically possible, but is extremely unlikely process to be converted from the messenger RNA into a DNA to reach our nucleus and get stitched or get into our DNA. So even if this like a 1 in a million chance of happening, even if it did happen, is extremely unlikely to cause problem. So that covers the myth about how is this RNA vaccine is going to affect our DNA. Third myth is that some people have seen claims that a large number of people are getting seriously ill from the vaccine, and the risks of the vaccine aren't being reported, or the officials know that they are long-term risks, but they are keeping them secret. The fact is that coronavirus vaccine have caused a fever, headache, fatigue, sore arm or chills, especially after the second dose, which is supposed to be stronger than the first dose because the immune response was going to be way bigger than the first dose. But other reactions are extremely rare. But the fact is, the long-term risk of the vaccine hasn't been studied yet, but the risk of a very severe complication are rare, but you need to report any symptoms that you might concern. Tens of thousands of people have received the vaccine in the clinical trial, and every day thousands are getting it. And now the first two vaccines are approved. They are all being asked to track and report any symptom if you experience it. And the health authorities have also reported a few cases of severe allergic reactions or a face nerve condition, Bell's palsy, and have been seen in hundreds of the thousands of people are vaccinated so far. So it's rare, but they have received a lot of attention. So we also, just a note, we also don't know yet if the person who's vaccinated is still spreading the coronavirus or not. But just to be safe, if you're vaccinated, you need to still wear your mask until the researchers find more about that. Another myth is that all of these things and more have been mentioned in the claim. We have seen the internet or heard about people who contact us. People who hear these claims may be worried about health effects. Health effects that we are being tracked whenever we go, or a small chip have been inserted in the vaccine that is gonna monitor or control us. Of course, the vaccine does not contain any live or a whole coronavirus in it, or any microchips, or any tracer technology, or any fetal tissues, or stem cells, or mercury, or aluminum, or luciferase, or any mark of the beast, of course, pork product, or any preservative. The chips or tracers, there is no microchip or any tracer device that is small enough to fit inside the needle. That's for sure. So I think the concern that we are being tracked or anything, we should be focused on the technology that we have, the Facebook and the Google and everything, rather than the vaccine. What about pork? So, of course, people of certain faith and vegetarians and vegans concerned about the possibility of using gelatin, which is derived from pork, in the vaccine itself. The two vaccines that are already approved in the United States and Canada and other countries, they have been certified as gelatin-free, so they do not contain any pork product. Other vaccine they have been developed for developing nations. I believe they are not being tested or certified for being gelatin-free, and I don't know why. Some other myth and fear that the COVID vaccine can make someone infertile or impotent, or can harm a fetus in the womb, or make an immune system attack the placenta or hurt the baby or who is breastfeeding. The fact is that people are pregnant or breastfeeding or want to become pregnant can get vaccinated, but they should talk to their provider about that, because pregnant women have not been included in the study of the coronavirus or the clinical trials of the coronavirus, obviously. And there is no evidence of the claim that you can be infertile or impotent from that. There is no scientific evidence. Excuse me. But we know that they have a high risk of getting seriously ill if they catch the coronavirus itself. The virus also increased the risk of miscarriage or stillbirth. This is the coronavirus. Impotence and infertility have many causes, but the vaccine has not been linked to any, because the short term of the studies, and there is no evidence that the vaccine can be transmitted through breast milk. So there is a theoretical possibility that this could happen with the live viruses like smallpox and yellow fever vaccine, which are not commonly given in the United States. But the coronavirus, again, does not contain any live viruses in it, the coronavirus vaccine. Another myth and fear that there have been rumors that the vaccine have been given to eliminate the certain groups within our society and allow for mind control of the vaccinated people, or allow for some elite members of the society to rule us. The fact is the coronavirus vaccine, the COVID-19 vaccine, can end the pandemic much sooner with fewer lives lost. This could especially help people in the highest risk group, including people of color, which have been severely affected with the coronavirus. The studies of the COVID-19 pattern have shown that people in certain groups like Black, Native Americans, and Latino people, for example, have a higher risk of severe or fatal COVID-19 than people in other groups. So this is probably due to other multiple factors than their own ethnic or racial group. It's sometimes related to the health and type of the employment, the living situation, and access to healthcare. But it had been really noticeable in the United States that the Black community and the African American are hit hard with the coronavirus. It's understandable that some people, of course, may be more likely to mistrust the COVID vaccine because of the discrimination against the people of color. So, like them in other aspects of the modern life or history, the United States has an unequal distribution of access to healthcare, preventive health services, and health education. All these claims and all these that's actually happening makes the minority groups of the African American mistrust the vaccine. Another fear and myth is that the new mutation of the coronavirus, which has been reported that may change the nature of the protein on its surface. The coronavirus has a new mutation, and the new mutation involving that the spike protein on the cell surface, which make the virus to cling more and make it more contagious. So people are wondering that if this mutant viruses are also the vaccine can protect against these mutant viruses. The fact is the coronavirus is changing, but the vaccines are designed to help the body recognize and it's based on multiple parts of the virus. So actually the virus itself can change, but the vaccine is given to help the body to develop an immune response. So regardless of its outer cells or any other criteria, the body have an immune response against the coronavirus, no matter how it changes. The bottom line is, so far, the COVID-19 vaccine markers say that the new mutations seen in the coronavirus have not outsmarted the vaccine, thankfully. But it's important for the scientists to keep looking for mutations in the coronavirus that's infecting people now. So this will help them to know if we need to change the current vaccine or make a new vaccine against the COVID-19. Another thing that people with autoimmune disorders like rheumatoid arthritis or lupus have received treatments to lower their immune response, of course, or people with bone marrow transplant, or people undergoing chemotherapy, using steroids, or any drug that work to lower the immune system may be worried that this could react with the vaccine or not get protected by the vaccine. The fact is, people who have health conditions that affect their immune system or have got any treatment to reduce their immune response, of course, they have to talk to their provider about the vaccination. But depending on your individual risk of getting exposed to the coronavirus and your precise conditions and treatment and whether to get vaccinated or not, I think the CDC maintain a list of health conditions that might be or associated with higher risk of severe COVID-19. People with this condition who are not frontline healthcare workers or nurse home residents or workers in essential or critical job are likely to be prioritized for vaccination, but a specific recommendation have not been made yet. So the bottom line is that lies and myth about the vaccine spread so much that the people decide not to get vaccinated, more people could die and the pandemic will obviously last longer. So it is important to check out the claims and share the good information with others. It will take all of us, I guess, to fight back against any deadly misinformation. And this is where I get the the reference and the information for you guys. It's from University of Michigan Health Lab, Wellness and Prevention, and by Kara Gavin. And if you heard anything that is not listed in the stuff that I've mentioned, you can email them at their email and they will look into it. They're still gathering more information about why people don't want to get vaccinated, or what's the fears and what's the myth about them not wanting to be vaccinated. And one more thing, I have read it in the internet that Dr. Salk, who is an infectious disease specialist and professor, his father who invented the Salk vaccine, the polio vaccine. And he said that his father, it took him about 7 years to develop the polio vaccine. And at that time, it was the 1950s. and 50% of the population does not want to get the vaccine. So it's happening. It happened before, and it's understandable. People having questions and questioning the vaccines, but it ended up all of the people receiving the polio vaccine, and almost everybody is vaccinated against the polio. And hopefully that this will be the end of the coronavirus for good. Thank you for your time. And if you have any questions, of course, I'll be happy to answer.
Thank you so much for the excellent and precise presentation. That was great. Good job, you and your team. So if anyone wants to add or anyone wants to maybe ask questions, the floor is open now. Thank you, Azza.
You're welcome. I would like to ask and to hear from the people who get vaccinated so far. If you, Dr. Nari, get vaccinated against the COVID or not?
I did not. I'm currently still in Canada, so when I'm in the US, then I will get vaccinated. So, good question. Thank you. I agree with all the facts that you mentioned. So there are a lot of misinformation in the internet and social media, with some images and some videos and some discussion. It's hard to convince people when they look at images and videos and say, oh, look what happened. But if you go back to the facts, how the mechanism and what happened during the trial, and come with a scientific approach, maybe you can get into their, give them the right answer. Hopefully you can convince them. All right, go ahead if someone has a question or addition.
Hi, everyone. Happy New Year. I would like just to thank Azza very much. That was really useful information, and you covered a lot of points and like very, I would say, to the point and very interesting fact that you brought. So thank you so much, and I really enjoyed your presentation. And that's it. Thank you.
Great, thank you, Marwa, and again, thank you, Azza and your team. Go ahead if you have questions.
Hello, Omnia here.
Go ahead,
Hello.
Omnia. Go ahead, we are listening.
First of all, great presentation, Azza, and it was just to the point. The main issue here now, they just introduced the Pfizer vaccine here in Qatar, and the main issue is about pregnancy and fertility concerns in females of childbearing age. Moderna, they made it clear their vaccine is not for pregnant ladies or anyone who's planning to get pregnant, but the problem now is the Pfizer vaccine. Everybody's asking about the vaccine, everybody's interested to take the vaccine, but we can't answer the long-term effect. What if I got pregnant? What if it's affecting the fertility? So this is an issue need to be sorted out as well.
Completely agree with you, Omnia.
Yes,
Yeah.
you're right, Anya.
Khalid, did you have a question? You are muted, Khalid. Sorry.
Hello, everyone, and Happy New Year to those who celebrate it. And I would like to thank Azza for the precise presentations. And you pinpoint, I think, answers to the most hot questions or myths about the vaccine. I have just one question about the impact of the coronavirus or the COVID on, as you mentioned, on Black communities or African Americans. And according to your research you did, is this because of certain biologic factors or just a socioeconomic status of African Americans in the US? Thank you.
Hi, Khalid. This is, of course, a big question and it's still being researched, but it has been noticeable that the Black community have been hit hard by the virus. Whether it's a genetic factor or it's related to the environmental factors or their health maintenance or their health, because let's face it, the African American community here have the lower health and economic than the other than the white community, and we don't know if this is the primary reason or it's something related to the genetic factor being African American. I honestly cannot answer this. It's still being a big question mark about that.
Excellent. Thank you. Lubabak?
Okay. Thank you so much, Azza, for the presentation. Very nice, enjoyable, and you are very calm presenting good information. Yes, as you mentioned, regarding the minorities has been hit more, Hispanic and African American. Actually, I heard once Dr. Fauci was speaking about those categories are always hit hard by the infectious disease. And especially for coronavirus, one of the reasons that they are thinking now, it is their jobs was not the kind of job that they can do it as a teleworking as other people were able to do. So most of them, they were like maybe construction workers, and those are been working all the time that we are locked in. So I think that's one of the reasons they're saying that they were not able to do all of the precautions on these minorities. That's why one of the reasons they have like more hit by this coronavirus, but definitely there is a lot of area to look at genetic composition of those, and maybe more answers will come for that. But, thank you so much. It's a very nice presentation. Thank you.
Excellent. Thanks, Lubaba. Any other comments or questions? Really great presentation. Thank you. And hopefully this will help all of us answer some of the questions when we face or talk to other people, especially during the coming days. Excellent. If no more questions, we can actually, Ali has, go ahead, Ali.
Yeah. First of all, thank you, Azza, for this presentation. It's very useful and will help us to answer more questions for our relatives and for our patients also. I have a question. I don't know if any news regarding how long will the immunity last. So if you know or anyone knows. Thank you.
Thank you, Ali. Azza, do you have information?
Well, I believe it is intended to be a lifetime, but as we said, the mutations of the coronavirus, is it going to be any further mutations of the virus that's going to completely change the genetic composition of the coronavirus, so the body will not recognize it? This is also something that will be taken under consideration. Will the vaccine last longer, or the coronavirus mutation outsmart the vaccine? Let's hope not. So
Yeah, I agree with your answer. And usually, let's take the flu. It comes each year, and it mutate, and so the vaccine every year we get is effective, and the immune system will last. They say between 6 to 12 months. But as I mentioned, also the mutation might also contribute into what how the vaccine will infect people and affect patients. That's good. Hopefully, it will last longer this time for the. And I think one of the ideas is a two-phase, two injection. You get one, and then you get the other one to boost your immune system so that it will last longer. Also. Um, hopefully will help. Great. Roa, go ahead.
Hello, everyone. Thank you so much, Azda, for the presentation. It really covers a lot of points. I have two questions. The first one, I heard that it's like obligatory for the doctors in the United States to take the vaccine. I want to know is that true or not? And my second question is that for all of you guys, what do you think? I know there is a lot of stuff with regard to the cost and the storage of the vaccine itself. In a country like Sudan, what do you expect, like when this vaccine can be delivered to like third world countries? Thank you.
Excellent question. Anza, do you have a comment?
thank you for your question, Roa. Regarding whether it's obligatory for the doctor to get the vaccine or not, I guess Dr. Nadi can answer that better than me, but I believe everyone in the front line is, so from what I hear, that they want to get vaccinated. They want to be the first one to get the vaccine from what they see so far. Of course, doctors like everybody else have their concerns about like and it's not obligatory. They cannot make you take the vaccine, I guess, but just like everyone else, a lot of physicians have their concern about the vaccine, but most of them wanting to get the vaccine, especially the frontliners. Regarding the vaccine being shipped to the developing countries, to Sudan, for example, I've never heard of, for me, if anybody else have heard about it, what it's going to be and how it's going to be shipped and how it's going to be distributed. It's a concern because the vaccine needs below sub-zero temperature to be stored. And I don't know anything about that. If anybody knows, so you can fill me in.
Thank you, Azia. Thank you.
You're welcome, Laura.
I believe that whenever there's a new vaccine, the company who made it, like Pfizer and Moderna, they will have hold on it for a few years. Then I don't know for how long, I think 2 years, then the WHO will take over because the third world countries, most of their vaccination are provided for free by the WHO.
Yes.
So this is, I think this is the only hope for Sudan. It's pretty expensive. Even here, for example, in Qatar, despite of their money and everything, they couldn't provide it for all. For now, they're
Yeah.
giving it to elderlies with multiple comorbidities. They even have age cutoff. And even for physicians, it's for frontliners only for now. They
Okay.
gave it to ED people, people who are working in Covet facilities and ICU. Even for us in the floors, nobody asked us yet. The
Yeah.
other problem I heard online that it will cause a travel issue, the COVID vaccine, because there is most of the countries are leaning toward making like something called COVID passport. You need to be vaccinated to be allowed to travel. So this I think if this happens in Sudan, this will be a main issue. It will enter the black market and it will be a disaster.
Of course. Thank you, Omnia.
Anytime, bro.
Hello everyone, Happy New Year, and thank you so much, Azza, for the amazing actually presentation about the vaccine. I do have a question about the new strain of the vaccine. So, does the vaccine cover it, or, as you said, yes, the mutation of the vaccine, and there's the new COVID and everything. But currently, the new one that we have right now, which is a 21, I guess, or 20, sorry. So, does this vaccine cover it?
Oh, hi, Dalia. The short answer for your question is yes. The vaccine covers the new mutation so far. Because the new mutation have only changed the outer cell membrane protein, which makes the virus to cling more to the tissues and giving it a more contagious, being more contagious. But the vaccine works by building up an immune response against the coronavirus itself. So it will recognize the virus regardless of its new mutation, and it will cover it. So far, yes.
Thanks.
Concerning Ross' questions about if it's obligatory or not, I don't think it is obligatory yet, because the principle of liberty is very essential to US Constitution, and also the principle of autonomy. They encourage like everyone to get the vaccine, but not yet obligatory. I scheduled my vaccine for the next week, but not obligatory yet to anyone. Concerning about the delivery of the vaccine to Sudan, I heard somewhere there are some organizations, I think they are able to secure around 7 to 8 million vaccine dose to Sudan. But when they will be shipped to Sudan, I'm not sure about that. Thank you.
For free, right, Dr. Khalid?
Yeah, absolutely, for free for Sudan. Yes.
Okay, thank you.
Yeah, thank you.
Great. Thank you, everyone. Any other questions about the vaccine or the virus? Here, I think in our hospital, they offer it. As Khalid said, it's not literally obligatory. They just encourage everyone to schedule and get the vaccine. For nursing homes, I think it might be required as far as healthcare provider because of the risk to the residents there. So I think it depends how far they can push you to get the vaccine. Residents, I'm not sure. Each resident program might have their own way of convincing residents to take the vaccine. But I think if you work in the hospital with all these patients with the virus, I think you will be convinced to take the vaccine. Okay. I don't see any raised hands. If you have any comments, please, or questions, go ahead. In the meantime, we can talk about next section, unless either wants to add something or someone else wants to add something. Okay, why don't we That's great presentation, Azza. Thank you. Thank you so much. We really appreciate your information and presentation. Anyone with information or updates about interview schedule or tips or any experiences, please raise or go ahead and share. I know it's Christmas time, holiday times, but maybe someone has some good news or wants to share.
I have a question.
Yes, please.
As you mentioned, Dr. Nader, the inbox is very silent for the last week. So I want to ask everybody, what are the expectations for the upcoming January and February? Especially the rank in this season will be delayed like 2 weeks later, I think, than the regular time each season. So do you guys expect like there's more chances to get interviews, or it's like the end of the season in this January? Because I have heard in the Facebook, people they are saying that this season is different and the chances for interviews in January are equal to those in December and November. So what do you think?
Go ahead. Yeah.
Yes, but I'm not sure if she asked you, Dr. Nader, or everyone else.
No,
Everyone
everyone.
else.
Oh, okay.
Yeah.
Okay, Roa. So I guess for sure this year is different in so many ways. Nobody's canceling their interviews. So it's very hard to predict that if January is going to be different because like the waves of interviews that some programs have.
Yeah.
But some programs, of course, send out they already finished their interviews since December or early November. I mean, early December. So nobody can predict. We would just be hopeful, for January, February. Uh, People still get interview. Even last year, I think till January they got interview, but that would be because a lot of people cancel their interviews because they have to travel and stuff like that. So it
Yes.
is very hard for someone to say that like it's for sure going to like it's for sure that we're going to have interviews. We'll just be hopeful, That's all we
Thank you,
can say.
Dad. Thank you. I agree.
I agree too. It's hard this year to predict. So let's just look at the bright side and wait and see. Surgeon usually uses them wait and see. Any other information or comments, questions? So we can switch to the third part about the research update. We submitted the data to the statistician, and we are waiting for him to come back with analysis and hopefully with some graphs or anything we can work on and resubmit the abstract for the COVID and depression. We gave him the table also for falls and injuries. I will wait for him to look into that. So it's work in progress so far. Any questions or addition about the abstracts?
I have a question.
Yes.
Well, regarding the abstract about the depression, the one that was accepted to be published. So we're waiting for the results. I know this part, but I believe we should be in the process of writing something meanwhile, because like when we submit, this is not going to be just the results. It's going to be like we need to put other parts like introduction, discussion, and this. I know mostly the discussion will depend on maybe the results, but to have a baseline literature review and introduction maybe, and I don't know if like my question is mainly to Lubaba being the leader, and to you, Dr. Nader. Is there anything like meanwhile, because it's not too many days left. From what I understand, it should be the 8th, the time we submit. And correct me if I'm wrong. So is there anything meanwhile has to be addressed, just so we can be aware of our roles here? Thank you.
Thank you. Actually, Dr. Nadir can correct me, but I think we are waiting for the data analysis of this part. Basically, the goals and the introduction we submitted previously, it's based on some literature review, some articles from similar COVID and depression in Europe, and I think one article from Africa. So based on that, I wrote the introduction. So we'll wait for the data analysis now, and we do the discussion about what we have, and then maybe compare what's found in Europe and what is our recommendation and what is the gap that needs to be filled. But at this point, I'm not sure what else we can do other than waiting for the data. Dr. Nader can add.
Yeah, I agree with you, Lubaba. So when we submit an abstract, as you remember, we can submit an abstract full components, the background, the objective, what you want to say, and then you go into how you obtain, if you obtain data analysis, and then discuss the result and your final comments, and you add the reference. So for this abstract, we submitted the first part, introduction or background, and then what we did, obtain the information about how the process, the method. Though we did not add the result and the discussion part because we didn't have the information or the analysis at that point. The reference already was included in that submission. So they asked us to add the result and add the discussion part of the conclusion, which will happen after we get the analysis back from the statistician. So at this time,
all right, thank you.
At this time,
yeah, thank you.
It's waiting. If, let's say, we plan to publish something in a journal, then we will go through the same steps. But at this time, we want to focus on the background. We can add more references, add more information about what in the literature, so that by the time we come to the discussion part, we can compare what we have to what in the literature, something like that. So you can work on that. But for the abstract itself, I don't think we need to go further. Thank you, Lubaba and Marwa. Any other questions? Khalid, go ahead. You have a question.
Yes, actually, my question, Marwa already asked my question. It was regarding when we will get the data back. So regarding the false abstract, because I want to submit it for the AGC conference. The deadline, I think, is on the 13th of this month, which is 11 to, I think, 11 days from now.
Sure.
So I think we will just wait for the data and try to submit it for the deadline.
Okay. For your abstract, I think we need to change a little bit of tweak the title. So we can look at AGS what they accepted in the past, and we want to see what if they have any themes or anything that currently they need people to submit according to, so that we can target them effectively as far as the title. And then you already have the background methods. So I agree with you. We need the analysis part and the results and discussion. So hopefully, I don't think it will take him long. I think it's just the holidays. He has new kids and family. So holidays here takes a while for people to come back to normal. So hopefully within the coming few days, we'll get the results and hope I'm hopeful that it will be done.
Okay, I've already looked into their website. I will check it again. I'll try to tweak to change the title a bit and maybe look for other references. It was difficult to find, but maybe some were added in the past month, and I'll send it to you in an email.
Sounds good. Excellent. Good. Any other questions or any other comments?
I have another question. Also regarding, like I asked this question before regarding if we want to like ask for more information regarding the COVID risk factors for severe disease and in elderly people. My question is, well, can we work on what we have at this moment and maybe ask for like a submit? Can we submit, for example, an IRB requesting a specific data? For example, labs such and such and such, and we specify what we need, and at the same time work on what we already have. Like if just an estimation, how long that will take compared to starting a process of submitting like a total, like something from scratch. For example, focus on a separate aspect such as like what we want. If we do it like as an extension to what we have already, I know we're gonna ask for an IRB. Do we have to stop and wait until they approve and then continue, or we can proceed with what we have and ask at the same time for more data? So if that will shorten just the time rather than starting a new process. Yeah.
Excellent, excellent. So I agree with you. It will be as addition or addendum to the application that we submitted to the IRB. So in theory, it should be faster compared to the initial application process. As I said, the devil in the details. If you want to add items you need, like lab, if you can get this information automatically, the IT team run a report and it will be generated similar to what we have, it will be faster. So I don't think it will be more question for them or clarification for them. If, however, on the other side, you want to add some factors or information that you want, variables such as you want to get into the chart and review the chart and get the information from the chart manually, not as a patch, as a whole automatic query, then it will be considered as accessing the file, each file. By doing that, you need someone to have an access to the actual file. So you need a permission from Sparrow Hospital to the medical records to be accessed. I have privilege, I can do that. Sumi doesn't have that, she has MSU ID. Any one of you guys don't have that. So in itself, it will be a different process to get an access. And then you look at the chart and then review the chart, get the information, the details that you wanted. So the short answer is yes, we can add addendum. it will be shorter if you know exactly what you want to look at, and that can be done automatically through a query that run by the IT team. How fast, I'm not sure. If you want to look inside the chart and then obtain information, it will be a longer process. And I'm not sure how long it will take. Does that make sense for you guys?
Yes, thank you so much. Yeah, I get
You're
it.
welcome. So if you have items or variables in your mind, guys, put it and submit it to me or Sumi, and then we can see what the next step that we can, if we want to proceed, or if it's something that we don't want to proceed with what we have, we can go ahead and get something published at least. Thank you. Any other questions or comments? So next week, I think the other team will present, and hopefully we'll have a good presentation, good discussion, similar to what we had today. Any other suggestions or any? Ali, go ahead.
Yes. I want to ask about the case report. Any news, Marwa or you, Dr. Nader?
We just discussed it before we start the meeting. So Marwa was asking about additional information. So I think we need to look. I'm going to do that. Look at the chart and see if you can get background or additional information as far as complete picture from the chart, clinical findings, exam, test, lab, X-rays, whatever we can obtain from the chart, that will be good. Good. Anything else?
I just would like to add one thing. I don't know if we need to make some changes to what we have submitted already, but I would definitely start reviewing it. I believe everyone have access. So like if I made any changes, it's gonna be like, maybe I can make a separate document. So it's like, maybe we can look into the changes. Everyone can agree on it. If you have any suggestions, please go ahead and you can contact me. Unfortunately, I don't have a phone yet, so I'm not available on WhatsApp. You can send me an email. I'm gonna try to work on the information that we have already, like the document that Dr. Nader sent to me. I'm gonna share it with every one of you who is involved. So you have like the basic information that we use to just write the abstract. I'm gonna try to extract as many information that are relevant and add them as if like we're writing the whole thing until we get more information, hopefully soon, and we just proceed from there. Okay.
Sounds good. And if I may suggest, do you have like a Google document that people can share and then edit together?
We already shared that one.
Okay.
I think I added everyone to that one already.
Sure.
So
All right.
yeah.
Sounds good. Okay. One another suggestion is for the case, we can go ahead and look at what kind of journal that would be interested in similar case. If we can find some, then maybe we can tailor that into an article, and for that we can start working on that aspect of the, we call it an article aspect instead of the abstract. The abstract is kind of smaller. The article, we will need to pull out some more information as far as background and discussion and so forth. So good. Any other questions, comments?
I just would like to add one final point to this. Please, everyone else who's involved, I would appreciate if any one of you made some maybe literature review, and if you have any article that or case report that may be similar or interesting, please share. I can share with you all the ones that I have downloaded initially to write the abstract. So if you find more things that can be useful, don't hesitate to share.
Sounds good. So as far as the teams and team leader, I got a couple of emails back about the task for or the projects each one member of the team is involved in. I think I'm waiting for 2 other team leaders. If you can send me your team members projects list or interest, I really appreciate if you can do that. I know some might be missing this meeting. They are not here. So just if you can let those who are absent, the leaders to shoot me an email with each individual in the team and their interest of the project. Thank you. Final point is hopefully by the end of this week is I hope everyone will be able to finish the slides about the GRS, the geriatric syllabus, review syllabus, and try our best. We can review our presentation or improve some aspect, but do your best and submit your video or your file. Any other questions, concerns, or comments?
I know I said a final question. I'm adding the last question maybe here.
That's fine.
Sorry for asking too much. Just one thing. I have a question regarding writing, for example, the introduction to, let's say, case report. So I know there are points that we take from the specific similar case reports or something and you reference them accordingly. But do we need to paraphrase it or do we just put it in the same, do we have to stick to the same way that they were mentioned in that article, or can we paraphrase and still refer to it or cite it in the references? Honestly, because I haven't been through this before, I'm not sure the exact process regarding this part. Thank you so much.
You're welcome. So if you put it as a reference in your discussion, you can mention that in previous case studies, they found so and so. So you paraphrase what they wrote in the previous study or the report, case report. If you have, I think that's the best approach, is just to paraphrase.
Okay, thank you. And that applies to the introduction part as well, right?
Correct.
Okay, all right, thank you.
So in the introduction, you will say, basically, this is a common thing, and then this is what's happening. Most likely, you don't want to mention the report at that time. You want to mention it in the discussion part. You can say, let's say, for example, joint arthritis is common in older patients and it can affect shoulder mainly, let's say, and you can put some references for that. And this will affect their activity of daily living, like dressing or something, whatever you find in the literature as far as a background. And then you can mention that some interventions such as joint injections can prevent that from happening or improve the range of motion, whatever. In dementia, then you can mention that pain can affect the behaviors. So the introduction can have 2 or 3 main points that you want to let the reader know about why you are going into that direction. And then you put down the case. So we have this interesting case we want to share. A patient is old or whatever, presented with this, and then this is the findings on the history, on the exam, on the lab test or x-rays. And this is what we did, and this is what happened after we did. Then in the discussion part, you will mention that we found in the literature or previous studies showed that something, and then you mention or paraphrase what happened with other studies. And then you can add your findings in a way that might be useful to others. One way to put it is you can put a table with what's the commonest medication that's used for intra-articular or inside the joint, like the doses and side effects in a simple table, let's say. And then you can just mention in the conclusion that whatever conclusion you want to say, let's say pain improvement is important in patients with dementia. We find that injection can help pain improvement, something, and it can be a useful intervention, something in that line, so that when people look at it and read it, they can apply the knowledge that they gain in a nursing home setting, let's say. If they don't use that, they can consider using that, something like that. So the main goal is this is a case and this is the intervention. Hopefully this will be generalizable and usable in patients' dementia, if all that makes sense for you. Thank you. Any other questions or comments? All right. Thank you, everyone. I really appreciate your input, your sharing, and your interaction. We'll see you next week. Have a great day or have a great night. Lubaba, you want to add something?
No, I just want to say have a good weekend. For the rest of your weekend.
Thank you, everyone.
All right.
Thank you, Tonada, and thank you, everyone.
Okay,
Thank you.
bye-bye.
Thank you so
Thank
much.
you.
Have a good
Thanks.
day, everyone. Thanks.
Thank you.
Thank you, and bye. Have a good day.
Thank you. Bye-bye.
Okay, have a good day, everyone. Okay, bye.
Bye, Ali. Assalamu alaikum.